Well, I'd like to talk on thalamotomy for focal hand dystonia. And most neurosurgeons, when they hear the term dystonia, you may imagine that such kind of generalized severe form of body twisting or movements, which used to be called the dystonia musculorum deformans or torsion dystonia, which was first described by Oppenheim in 1911. And of course, for such kind of generalized dystonia, GPI, pallida, deep brain stimulation, is a good choice of treatment. However, there are so many types of dystonias, primary and secondary. And among primary dystonias, which is classified into early onset and adult onset. The most common form is, for example, cervical dystonia, blepharospasm, and so on. But also the focal hand dystonia is very common, which is sometimes called writer's cramp. And for example, this patient cannot move the thumb like this, or this patient has abnormal flexion of the wrist as shown here, and the difficulty of drinking. And this young man had abnormal extension of the middle and the second finger when he plays guitar. This lady has abnormal extension of the little finger here. Such kind of symptoms, like characteristic for focal hand dystonia, sometimes called occupational dystonia. Majority of IPS belong to focal hand dystonia. And also among musicians, it is very, very common. And such kinds of condition, writer's cramp or musician's cramp, were described first by famous neurologist Charles Bell many years ago in 80s or 1865. And this is a description about the violinist dystonia. However, for many, there has been a big debate whether it is neurological or psychogenic. But in 1982, British neurologist Dr. Marsden concluded that the writer's cramp is a physical illness rather than psychological disturbance, and he concluded that it is a focal dystonia. And the patients with writer's cramp use such kind of devices to correct writing. They try biofeedback, rehabilitation, medication, and Botox injections. However, the majority of patients are not very happy with such conservative treatments. And also, as for musicians' dystonia, it is, of course, occupational, task-specific, and it occurs in any kind of musical instruments, and many professional musicians are suffering. And the prognosis as a professional life is very poor. Many famous musicians stopped playing. For example, this is the musical note composed by Robert Schumann called Toccata, and you can play this music without using your right middle finger. And as I said, long-term outcome of focal dystonia in musicians is very poor, as you can see here. And such kind of dystonia may be seen in players of wind instruments, which is called embouchure dystonia. And we treat such kind of musicians dystonia also with ventral oral thalamotomy. And during surgery, as you can see here, they bring their musical instruments like this.
はい。
And you may say such kind of symptoms are very minor, and it doesn't need the neurosurgical treatment. But already many years ago, British doctor Poor described about pianist cramp, and he said, when I use the word minor, they are minor only to your eyes, only for doctors, and it's in its pathological sense. They are maximum importance to the sufferers because they may lose their own job. And they basically this is a circuit, a thalamocortical basal ganglia movement, and dystonia is considered as the abnormal oscillation of this circuit, like this. This is the overexcitation of this circuit, and so which is triggered by special sensory input. This is the mechanism of task specificity. So we block this overexcited neural circuit by putting a small lesion in the ventral oral part here of the thumbs. And in 1997, the Dr. Goto reported the first case of stereotactic ventral oral complex thalamotomy in a patient with writer's cramp. And he made a lesion here, ventral oral nucleus, both posterior and anterior. And the improvement was remarkable. This was before the treatment, she was unable to write anything. But this is a nice, very good writing after ventral oral thalamotomy. The lesion is several millimeters anterior to VIM nucleus. VIM is usually a target for tremor, and but several millimeters anterior to VIM, there are VOP and A nuclei, which receives the fibers from internal segment of globus pallidus. And this, based on the Dr. Goto's experience, this was my first treatment. It was the year 2001, and this was a young woman, professional comic artist, and she had been issuing such kind of comic books for many years. And then she suffered from writer's cramp and stopped working. And she underwent the ventral oral thalamotomy. And 6 months later, she started issuing the books again. And finally, in 2008, she was recorded in the Guinness Book as the most popular manga artist in the world. And this is an example of the operation. Operation is done under a completely awake state. And this patient has difficulty of writing like this. And I am making a lesion like here. And she was surprised a big change immediately after making a lesion. And You can see the change of writing after lesion made in the ventral-oral nucleus. And we check the movements during operation. This is use of chopsticks. And we usually don't shave hair after operation. And it takes around 30 minutes. And we have already reported the small series of ventral-oral thalamotomy for musician's cramp, and the duration of the symptom in average was 8 years, and we have followed up nearly 2.5 years. And the score of dystonia before operation was 2.7, and the five means the full. And at the last follow-up, the mean score of musician's cramp or difficulty of playing was 4.6. There were no severe adverse events. And also, we reported 2 years ago in neurology about ventral-oral thalamotomy for focal hand dystonia in 171 patients, including writer's cramp, musician's cramp, and other occupational dystonia, as you can see here. And again, it showed safety and the feasibility of such kind of treatment. And as you can see here in this study, the before treatment, the point 1 means unable to use hand at all. 5 is completely normal. And after 4-year follow-up, in average, the point remained stable at the 4.4. And there are several transient side effects, such as dysarthria or verbal recall disturbance, but no severe adverse events were seen. And this is an example. This patient has abnormal flexion of the little finger when playing violin. And this is during the operation. And we're checking the movement. And this is after the treatment. Now he can use all the fingers like this. And this is a drummer. Flexion wrist, like this. And another drummer.
全然違う。こんな風にできなかったですもん。
Big difference. Very quick.
すごい。
This is amazing.
すごい。
So we do
嘘じゃないですね。
operation in such a way. And some patients may suffer bilateral symptoms in case of musician's hand dystonia. And we have treated bilaterally. Of course, this is staged about 1 year apart. And of course, there are transient complications such as hypophonia or dysarthria, but there are no long-term permanent complications. And such kind of writing difficulty may be seen in a young child, and she's 13-year-old and unable to write. And we made a lesion ventral oral nucleus here, and this is after treatment. This is nice writing in Japanese. And this is a watch maker, and he can't use the thumb and the second finger, and he can't turn the screw. But after treatment, his movement of the fingers became completely okay, and he returned to the professional work. And this is a patient with focal leg dystonia. When he goes down the stairs, uh, his left foot became inverted, while when he goes up, it is completely normal. This is a typical example of task specificity. And after ventral or nuclear thermotomy, his walking became completely normal, as you can see here. And we treat such kind of focal hand dystonia in sports athletes. This is, for example, table tennis player during operation. He is left-handed, and I'm asking how she feels. And this is before the treatment, and after 1 month, she became like this. So focal hand dystonia is not common among professional athletes. This is a tennis player. He says,
I mean, for sure, 100%.
Yeah? Okay, feeling different?
Feeling a little bit different.
a little bit different, but 400% sure, he said. Okay. And the operation time is not so long, around 30 minutes. In some patients, we can finish it within 15 minutes. We use, of course, macro stimulation during operation. So it was natural for us to apply our results to the focused ultrasound treatment like this. It is in Japan approved for Parkinson and essential tremor, but we started clinical trial of ventral oral thermotomy for patients with dystonia by using focused ultrasound. And this was the first patient with guitarist. We made a MR compatible guitar like this, and it was 2017, and we already finished the study of 10 cases, and we have already submitted submit the results. This is the first patient, and this is before treatment. The fingers are bent. You can see here, and this is after the treatment. Focused ultrasound lesion immediately after, very large, but it disappears, almost disappears within a year. And also we can treat such kind of focal hand dystonia by using gamma knife. This lady had the cardiac problem, and she was on warfarin or aspirin, and completely out of indication of surgical intervention. And her play before treatment was like this. She can't use thumb, right thumb is bent. She can't use it. And after the treatment, her play remains the fingers, and if you can be interested. But I don't recommend all the patients with gamma knife treatment because it may carry unexpected complications. And I also don't recommend the deep brain stimulation because of very high possibility of hardware-related complications after many years. And deep brain stimulation can only give the control of the symptoms, while the thalamotomy or lesioning, radiofrequency lesioning, brings cure to the patients. So in conclusion, radiofrequency lesioning plays a very important role in movement disorders. It is safe and effective, and the ventral oral thalamotomy can bring cure of focal hand dystonia, and the lesioning is, I believe, underutilized. Thank you very much for your attention.